As we think then about getting this really good desired outcome, this sense of clarity, knowing yourself, having peace, those kinds of things, it obviously begs the question, so what do I do about it? How do I move toward helping her get these things? And one thing that I want to make really clear is that we don't want to inadvertently move to a place of problem solving. We don't want to transition our client into saying, okay, you want clarity or you want self-knowledge. What's one thing you could do to get clear? What do you need to think about? Could you make a pro list and a con list and weigh those back and forth? We don't want to give them suggestions. We don't want to tell them how to fix their problem. And I think this is one of the real tragedies of solution-focused therapy, is that it's named wrong. Solution-focused therapy means, or it sounds like, we just focus on the solution. Okay, you've got this problem, you don't have clarity, let's solve it. Let's brainstorm what are all the ways that you could get more clarity. And that isn't what we're doing. What we're doing instead is that we're developing then a description that includes the differences that would occur if the desired outcome was present. So we're not talking about how do you get clarity, but we're talking about the difference having clarity would make. And we do that with 3 different types of description. And in a solution-focused session, you can use one of these, or you could use 2 of these, or you could use all 3. But you want to build a coherent description around, if your desired outcome is present, what would occur that would be different? And so I think that's one of the things that's really important to remember here, is that solution-focused isn't necessarily a solution-focused approach. It's a difference-focused approach. And so we want to consistently be talking about the differences. So the 3 types of description that you can use to describe the presence of the desired outcome is, you can talk about the history of the outcome. When in your past have you had this before? And we'll talk a little bit more about each of these in detail. And the second one is resources for the outcome. And when I say resources, what I mean are, what skills, what qualities, what characteristics, what traits do you have that would make the desired outcome even be a possibility? And so we'll talk a little bit more about that in a minute. And then the third type of description is what we call the future of the outcome. If your desired outcome showed up at some point in the future, what would begin to let you know, and how would you notice, and what would be different? And again, we'll get into talking a bit more about that in detail in just a bit. But you can use these 3 different types of description to highlight, in some sense, something that's consistent with that stance, that you're capable, that you're competent, that you have what it takes. All of that is in there. We're not trying to develop a plan for how you can become that, but instead, we're working on the presupposition that all of that is in there, and that as you describe it, you're going to be more likely to utilize it. So by describing the presence of this outcome, then most often what happens is the client begins to notice that pieces of their desired outcome, or pieces of what they're hoping for, are already beginning to take place. And that they already know how to create a bit of this, because they've done it before. They already know that they have the resources that they need, or the strengths that they need to have. And so simply by talking about it, they know that they become capable of having it again. And so I think that's a really important kind of idea that goes along with this stance, is that if we really buy that our clients are capable, what that means is they have everything they need in order to live according to their desired outcome, which can be a little bit difficult to hold on to as clinicians sometimes. So if you find yourself losing that vision of people, you have to pause, and you need to ask them enough questions that help you catch that vision of them again, to be like, man, they are incredible, right? They are amazing. They did do these things. And in the case of Georgia, I think about these things that she's done that are amazing, right? Moving to a different country as a teenager, that's incredible. That's hard. That's difficult. She thrived here, right? She was able to make friends. In addition to that, she was able to find a partner that she lived a life with, that she had 2 children with. And for most of their relationship, she would say that she was very happy. She was satisfied with that. She also was somebody who got 2 degrees. That takes so much effort and so much work and so much dedication and sacrifice. If I could just get an idea of how she got those degrees and what it took to get those degrees, I would learn something about her that would help me to know if she wants clarity, if she wants self-knowledge, deciding on what degree to get, focusing on how to make her priorities go in a way that would help her achieve that accomplishment. Those are times where she had clarity. Those are times where her self-knowledge was at a peak. And I can use those things as we move forward in our care. And so I want to listen through all of the things that she said, and I want to find that capable version of her, because I'm going to need to talk to that version of her in order to move forward in the decision making she's got to make right now.